Thank you very much. And the HITS program, the Health Intervention with Targeted Services, was a vision by Mr. John Benz, who is our Vice President and Chief Executive Officer. And he's been my mentor for the last 15 years, and I'm very, very fortunate and grateful to have him as my mentor in this industry. John brought together the right people. Even in the program development, the stakeholders were involved. The ownership of the program was always the community's. It wasn't really ours. We were the facilitator of this program. So the Department of Health was on board, the small social service agencies, which served a lot of the minority health and those folks that are underserved, were on board. The Homeowners Association folks, we had everybody involved that needed to be involved to make this program appropriate to be implemented. And once it started to be implemented, as you heard on the video and the words that were set up here, folks responded. We developed community trust very, very quickly. We had community buy-in. We used faith-based organizations to do educational presentations. We used community centers to park our van to allow the uninsured to come in and get well checks, and at the same time, we'll run some eligibility documents through the process to get those folks who are eligible for entitlements, get them insurance, because that was very, very important to the overall process. The idea of compassionate outreach was very, very important to us and continues to be. And that's really what the nexus of the success of the HITS program has been, to understand the community, what the community values, and how we can be part of that value system. The goals that you did here were improving the health status of the community, maximizing the resources that were available and the entitlements that were available to the folks that didn't know how to access those. And that's what HITS does. The staff go door to door, sit down in the living room. One of the unintended benefits was we realized very quickly that the HITS staff needed to be really effective case managers, because folks didn't want to talk about health until while their belly was growling, or while they didn't have their lights have been off for the last 2 weeks. So we became very, very effective case managers at the same time to provide those basic needs before we could even talk about health status. The project did save millions of dollars, but more importantly, we saved many, many lives and improved the quality of life for many of the families in the South Broward Hospital District. Thank you very much.